very good and a blessed morning to everyone. I would like to thank each and every one of you for being here with us at this live sessions from MAHSA University's Saujana Putra campus. I am Kangamal Kumaran, clinical instructor from Faculty of Nursing Science, MAHSA University, and I'll be moderating today's session. Today's webinar titled Caring for Patients in Surgical Smoke. And this webinar is proudly organized by the Faculty of Health Sciences, MAHSA University. And now let me introduce the speaker of today's webinar is Ms. Sivasakti Davodran. Ms. Sivasakti holds a Bachelor in Nursing Hons from University of Sunderland and has post-basic in pre-operative care. She has 15 years experience as a senior staff nurse in operating theatre, currently working at MAHSA University as a nursing lecturer.
Thank you, Puan Gagama, for the introduction, and
Now
thank
the
you.
screen is all yours, Ms. Sivasakti.
Thank you, Puan Gagama, for the words. And have a blessed good morning for everyone who joins these sections. And I'm pleasant for the opportunity that given by MAHSA University for me. So, as we begin, preoperative care is one of my expertise, my interest. So before any delay, I could like to start my slides. My today title will be like caring for the patient in surgery, preoperative nursing, and surgical smoke. Without any further delay, the introduction today title will be like electrosurgery in use in 80% of a surgical procedure has been become common practice for the OR surgeon, specialized in surgeon in the small physician practices for the simple skin procedure. Basically, what is surgical smoke? A lot of benefit have been associated with the small use of electro surgery for the both of the patient and medical facility. However, the use of electrical surgical devices created by the byproduct of surgical smoke. Surgical smoke is a potential hazard to the patient and the staff and of a risk of the medical facility. All right. So basically, we have overall statistic research based from overall university and the world. The statistical data suggest that each year in United States and around 1,000 of professionals, including surgeons, nurses, and anesthetic, are exposed to the surgical smoke hazard in operation room, such as exposure of accumulate over the lifetime. So this is our recent research, even though we are currently doing a research. So what is the definition of a surgical smoke? Surgical smoke basically is a smoke of aerosol in the vibration of the substance, mainly by the tissue, fluid, and blood are into the gases from their byproduct of a surgical instrument used to destroy tissues. All right, so what basically the surgical smoke are produced, how is really produced by? So maybe during operation, or some of you are maybe operating theater nurses, or some of you may be doctors, or some of you maybe a background from medical staff. So a layman term, actually, I need to introduce without any medical background or those of viewers now. Surgical smoke actually the diatomass are from a tissue during operation theater basically do for the coagulation purposes and to prevent any bleeding. So the heat of the diatomy causes the target cell membrane to rupture its boiling point and subsequently generate a puff of the smoke. The smoke contains water vapor released into the atmosphere. So then the heat created by the char protein and other organic matter within the cell causes a thermal necrosis to the cells. And then later on, the charge of the cell are released for other harmful contaminated, such as carbonic cell fragment and gases, hydrocarbons. So this is really dangerous for us, for human being to inhale and during our surgical time. So there are variant of type of surgical smoke and devices. So I could like to show and share you some of them. All right, so what are basically a type of smoke surgical? An example of the procedure and devices. So the type actually is number one, electrosurgical unit, we call ESU. I use a general surgery, we call diatomy in layman terms. So basically I use for surgery mainly for major surgeries, it's like laparotomy or an excision of a lung. So basically doctor as a surgeon, we like to cauterize to prevent any further bleeding. So by that, you will get a smoke will come through from the vibration. So, and then second, we like laser tissue ablation. So it will be like some cases like laser hemorrhoids, and we call URS, is a ureteroscopic lithotripsy. And if we use a laser probe to cauterize or maybe dissect the cyst. In thirdly, other cases, we also use a terminal ultrasonic scalpel dissection. So this is mainly for laparoscopic surgery. So nowadays we have a lot of instruments for cauterize and diatomize for all the purposes. So this is basically for laparoscopic purpose. So what we do, we have harmonic scalpel and we use ligature. And the fourth and final will be high-speed drill, power drill or saw blade for burning electrical devices. So this is mainly for uses for neurosurgery. So we call burr hole or orthopedic surgery. Also we go uses drill bits or power saw blade. So this is our mainly purposes for cutting and dissect all the way the surgery. So that's also one of the type. So as we have a research, then we have proven the component of a surgical smoke are basically from 95% is water. And then 5% will be like other particular gases, vapor and microorganism. All right. So in other cases, we have a lot of more than 150 different chemicals identified in surgical smoke. Mainly, we have the nitrates are almost that. So as you know, surgical smoke is not a sterile always, all right? So some people hire after interview or some of staff, they mentioned to me that surgical smoke might be a sterile content, so it doesn't have any bioagent at all. No, the perception is wrong. So we should have awareness about that. And the risk of a surgical smoke toward to all our personals are really high. So what kind of mainly will be affect? So it affect our respiratory systems. What it causes? It causes our nasopharyngulation, sneezing and throat irritation and acute and chronic inflammation changes in respiratory tract such as emphysema and asthma, chronic bronchitis. And other way, it also affect our eyes as a high irritation and lacrimation. Skin might have a dermatitis. In our gastrointestinal system, we could have a nausea, vomit, and colicky pains. It also in infection rate, we consider that is a immunocompromised lead to the infection. So it might be causes our more infection. And then other than that, we have a blood disorder such as anemia, leukemia. And other than that, we have a carcinoma, hypoxia, dizziness, headaches, and weakness in anxiety. So this is some of the really risky factor that causes OR personnel. Even though you're not scrubbing for the cases, as around the OR setup, you're also involved in this risk. Okay, and next, I could like to share some of research purposes. In the different study, allows a look at the issues assured with the surgical smoke exposure in 81 operating room nurses and doctors. They found that headache, watering eyes, coughing, and sore throats, odor absorbed in the hair, and nausea were their most common complaints. So even though it's happened to me while I was in stiffness in operation theater. So some of us are maybe experienced those, but we didn't realize yet. So what causes by that? All right, so now if you know the risk and we know the types and now we know the definition, so now how to make sure that you have the measurement of the safety precaution toward the OR personal tool that you can apply to yourself. So the first thing I could like to say that personal protective equipment we call PPE is a healthcare. I think this is the one of the piece of cake for us, right? So we always have a mask, but what type of mask we wearing? What type of facial goggles are wearing? And this is the most be emphasized to OR personal, even though in some specialties we are working on. So we have some preventive method as a mask are capable to filter particular at least a small of 0.1 mm are recommended to prevent inhalation of smoke particulate, and then wear mask fit and closely to the protect the inhalation of chemicals in your surgical smoke. This is I could like to emphasize on. Okay, whenever you're working, you're dealing with biohazard, you should have a fit mask to your nostril and you protect your mask as well to your mouth area. That's how you need prevention from any smoke or any kind of biohazard purposes. All right. And the third, wear appropriate PPE, face shields or goggles or protect eyes. You should wear that. All right. As a second measurement, I could like to mention that types of smoke equator. Actually, we have having an overall in the worldwide. And then we have a portable smoke equator. These are really small and mobile unit that we can easily move around in operating room. They are ideal for procedure in a different location or smaller in operating rooms. As we all know, we occupy of a lot of devices during operation theater. So this is one of the portable smoke equator that you can occupy during your surgery. And second, we have a handheld smoke equator we call suction. These devices are directly attached to the surgical instrument, such as electrosurgical pencil, your diatomy, allowed to eliminate capture of a smoke at the sources. So you no need to have a suction and surgical pencil in each end. So now a safer side, you can use a both are attached by the instrument. As I have spoken before, so I could have a picture of these two devices for your view. So this is a type of surgical smoke equation system, are really portable and attached with your diatomy pencil. The second in the picture is a smoke equator we call Evacuous 3000. It's one of the portable devices that you can move around in your operation theater. It won't occupy a lot of spaces in your setup of OR. And third airmost, we have now a lot of laparoscopic procedure for the worldwide, even though in Malaysia. So we could have a laparoscopic smoke equator that is can be evaluated through a specific laparoscopic smoke devices. It's a really easy to use device that connect to the standard Heckler lock trocar and suction or vacuum unit. So it's basically attached with your trocar, and as usual you can on and off. So as I know that laparoscopic, we have a gases, carbon dioxide, they have a one of trocar attached with, so it won't interfere the flow of the gases. So it is really easy to use. At the fourth, I could recommend that OR setup are most apply the part as a local exhaust ventilator, high efficiency of a particulate air we call HEPA filter. I need to be really capable to removing at least 99 and 97 percentage of airborne particle as small as 0.3 microns. And the second, activated carbon filter. These filters are used to absorb and neutralize harmful gases and odor from the smoke. So it should be emphasized with the OT setup. With the fifth measurement, I could like to administer a control. We should have a standard operating procedure (SOP). So implement or to use a smoke equator system (PPE) and other safety measurements. Ensure all staff are familiar with those procedures because we should have a standardized procedure, standard method to prevent all the measurements so that we have safe site while working. And the second, we should have a monitoring or audit frequent in OR personnel so that we are using a right method for our safety side as a patient and all around our setup. So regularly monitoring a compliance with safety measurement and conduct audit to identify area to improvement. And rather than that, as we all know, we are healthcare staff. Each every day we should have a training and awareness in each specialist our field. So I could like to recommend that to provide education for all staff regarding handling surgical smoke devices, to raise awareness to potential hazards, and third, to awake consciousness between surgeon and nurses on the importance of PPE uses. And the fourth, I could like to have to recommend that policy and procedure for the surgical smoke safety should be developed more and emphasized to each every day. Okay, could like to summarize a bit in my surgical smoke of preoperative care, caring for a surgery in a patient. This is a really implementing of safety precaution that can significantly reduce the risk of surgical smoke for operating theater staff and as a patient as well. Continuing education and adhering of your safety protocol and the use of appropriate technology and equipment are essential in maintaining a safety environment. So I could like to say that this is for our purposes that we have awareness and prevention and measurement of a further practicing in OR practice. So this is our webinar. So I'd like to thank you, MAHSA University, for giving me an opportunity for a separate and a spread of a love and awareness regarding preoperative nursing care, the title of surgical smoke. Thank you so much.
Okay, thank you, Ms. Sivasakti Davadaran, for the insightful presentations. Dear viewers, if you have any questions for Ms. Sivasakti, please leave a comment. Please fill in the survey form, which can be found at the comment sections by the end of this webinar. E-certificate will be awarded. We have come to the end of today's session. Thank you, Ms. Sivasakti, for joining us today and providing such insightful information.
And thank you so much, Pangama, for having me over here. And thank you for the opportunity. I'm really blessed.
And to our wonderful audience, thank you for joining us at this webinar. We look forward to your comments and participations at our future events hosted by the MAHSA University. Please fill in the survey forms which can be found at the end of these sessions by the end of this webinar. In case of any further queries, you can contact us through MAHSA website or visit our social media. Have a pleasant day. Thank you.
Thank you.